Well, I'm the president of the World Council for Psychotherapy, and I'm dealing with the development of psychotherapy since many decades. And I was one of colleagues to establish the European Association for Psychotherapy and then the World Council for Psychotherapy, which is a association which covers all continents and about 100 countries who work together in the field of psychotherapy. In 86 was the first law on psychotherapy, which regulates the profession of psychotherapy. It was done in Sweden. In the meanwhile, we have more than 11 countries who regulate psychotherapy. And the next step is Germany, which will regulate psychotherapy as a new profession. It will be a very huge step forward because it defines psychotherapy academically as an own subject in its own rights, not as part of psychology or medicine, but as a unity in its own academic rights. And then it will not be, psychotherapy will not be anymore a postgraduate activity, but a graduate activity, bachelor, master's, and then you can work. Well, that is a very complex question, because in most of the countries worldwide, there is no regulation by law or by the government. For instance, in Latin America, there is a lot of psychotherapy in Brazil, in Argentina, in Chile, and in many other countries, but the regulation is not existing or very small. The same, different it is in the United States of America. There is a lot of regulations, but psychotherapy is not defined as an own profession, but as part of other professions, like psychology, social work, medicine. So it is difficult to find a psychotherapist who is just a psychotherapist in the United States. He's always also a psychologist or a medical doctor or a social worker. Mm-hmm. And there's a big area of so-called alternative psychotherapy methods, which are not regulated at all. Well, there's the big score of more or less accepted psychotherapy method. There is the big group of psychoanalytic psychotherapies. Second one is the group of behavioral psychotherapy or cognitive behavioral, as they say now. Then there's a third group, which is systemic psychotherapy. Then there's a group of humanistic psychotherapies, which is Gestalt, transactional analysis, person-centered psychotherapy, belonging to the so-called humanistic methods. Then there are relaxation methods like autogenetic training and other kind of hypnotic psychotherapies. And there is a big group of methods which mix these mentioned modalities, integrative psychotherapy, and there is a broad scope of different modalities which call themselves integrative. Well, one approach is not enough to cover the complexity of the human existence, because people feel comfortable in different modalities. This idea of different modalities came up in the last 100 years, according to the development of psychotherapies in different areas in the world, and in the effort to understand psychotherapy differently, according to the desires, wishes, and ideas of the patients and of the creators of these modalities. And nowadays, we have to see what do they have in common, all these modalities. Just to give an example, empathy is very important for all kinds of psychotherapy. And what is different? For instance, some techniques are different to others. The laws can have different functions. One function is the quality control, because there are modalities where we have no knowledge about how efficient are they. And the law can provide this. They can install what they do. Mostly they install a council of experts which deal with the different quality of methods. But the law has many other functions, especially for the public. The public, when you have no law, the public doesn't know anything about the qualification of psychotherapists. Not even the name of psychotherapy is protected. And so it is a necessary protection of the public to define psychotherapy and its modalities and its function. Well, the other professions have no standpoint to psychotherapy. They're just other professions. For instance, in Austria, it is an own path. In Austria, we have a psychology law and a psychotherapy law and a medical law. Yeah. And the psychotherapy as a long-standing, as an own discipline, has the advantage that from the scientific point of view, the investigation, for instance, concerning quality is done concretely for psychotherapy and not with psychological measures or medical measures to psychotherapy. There are interactions certainly with the other professions, but it has the advantage that it is concretely done appropriate for psychotherapy. Well, clinical psychology is not the same as psychotherapy. Clinical psychology has a history in psychology and has many advantages in concerning developing different programs, for instance, for psychosomatic disorders, treatment programs, or for non-smoker programs, etc., etc. But it is not psychotherapy. In no country, the clinical psychology and psychotherapy is the same. Even not in Germany, yeah, where they changed the law now. To that, what I said in the beginning, that psychotherapy is separated from psychology totally. The historic development is that politics always follow the pressure of groups. And for a long time, psychotherapists themselves were not able to develop pressure in the public. But psychologists and medical doctors often had the idea, when we make pressure, we will get some pieces of the cake. But it has changed. And in many countries, many countries now in Europe, There is an organization of psychotherapists who fight for their rights and for the rights of the patients. There is another problem which is often not seen. That is that the patients, the clients of psychotherapists often suffer silently. Their neurotic disorders are often combined with shame and with private behavior, so to say. And therefore, the voice of such persons concerning their own problems is silent. The other example would be when you have pain in the teeth, it is clear you need a dentist. And therefore, the patients allowed when they have not enough dentists. But the psychotherapy patients, they are silent because they have a feeling of shame or that it is not appropriate to speak about the inner problems on which because the main reason is because there is a treatment which is successful, that is psychotherapy, and there's a knowledge now about this kind of treatment. And third, there are so many people who suffer of neurotic burdens that and now we have evidence that up to 30% of the population suffer of neurotic diseases. And therefore, the politicians must do something. Well, there are many other professions who claim to have an effect on emotional problems. There are lawyers, there are esoteric healers, there are priests, as you said, there are psychiatrists. So it's a big crowd of professions which claim to be helpful to people who suffer of emotional problems. It is not only psychiatrists and psychologists who are the competitors of psychotherapists, but the psychiatrists have their competencies, especially in prescribing psychotropic drugs, and clinical psychologists have a special competency in testing. And in that, they should be accepted as a conjoint activity to help patients. Well, that's easy. It should be on a respectful way to the patient and to the professions, to each other.
Okay. Thank you very much for that interview.
With pleasure.
And let's see how the future will develop for the psychotherapy profession.
All the best to you.
Thank you.
Bye-bye.